Hi, everyone, and welcome to the webcast. Thank you to all of you for taking some time out of your day to join us this afternoon. As most of you know, the CMS has recently finalized a new interoperability and patient access rule, which requires hospitals to send electronic event notifications of a patient's admission, discharge, and/or transfer to another healthcare facility or to another community provider or practitioner. Today's presentation will cover an overview of the new CMS ruling, the compliance requirements and how they affect hospitals, Summit's different solution options to help you meet these requirements, and finally, we'll go over some success stories of Summit clients who already have the solution in place. Just so you all know, this webcast is being recorded, and we will be sending out a link to the recording, as well as a copy of today's presentation materials to all attendees. With that said, my name is Christine Duvall. I'm the Director of Marketing here at Summit, and I'll be moderating today's session. Joining me on the line and leading today's discussion is Meredith Muir, our Executive Vice President, and Matt Baker, the Technical Product Manager, who will be providing an overview of the technology. So without further ado, I'm now going to turn it over to Meredith to kick off today's presentation. Meredith?
Thank you, Christine, and welcome everyone. So let's start off with what is the CMS ruling. It is to improve interoperability and really to make patient data more useful and transferable through open and secure methods using a standard and machine-readable formats, and really to reduce the burden on healthcare providers. This will be an important step towards furthering interoperability. The expectation is that this will be built upon in the future for healthcare to become more transparent with data for healthcare providers in order to improve patient care. The date to have these requirements in place is May 1st, 2021, and this is an extension due to the COVID pandemic. It is a requirement for CMS conditions of participation, and we'll get a little bit more into the hospitals, and it's going to include as well as those that will be exempt. And lastly, we'll talk about compliance that will be done by your state survey or accreditation organization. So let's dive into the requirements for CMS. We can discuss who must comply, what notifications are required, and where do these notifications get sent. So as far as who must comply, hospitals participating in CMS, Medicare, and Medicaid, they've also included psychiatric hospitals and critical access hospitals. Essentially, if your facility has an EMR or an administrator system, you must comply with this new rule. As far as what notifications are required, these are event notifications. So it's for patients' admissions, discharge, or transfers. Looking into that, you'll have inpatients that will need a notification, as well as someone presents to your ER, a notification will need to be sent out, and then a second notification sent out after they are either discharged or admitted. Likewise with observation, admissions, and registration, and transfers from outpatient to inpatient. If you have a patient that's being transferred between units within your facility, you do not need to send a notification. And then lastly, of course, on discharge. As far as where these notifications need to be sent, it is with the treatment, care coordination, and quality improvement for the patient. So the patient's primary care physician, the accountable care organization, a federally qualified health center, physician organization, independent physician association, or multi-specialty practice needs to receive these notifications, as well as care coordination. So think about your post-acute care services and providers, the skilled nursing centers, home health agencies, and hospices that may need to have care coordination for your patient. They must receive these notifications as well. And then for quality improvement, if your patient has a practitioner that is identified as being primarily responsible for their care, they must be notified on these events as well. So next, let's review when these notifications need to be sent, what data is required in these notifications, and how is it going to be sent. So notifications need to be sent immediately upon registration or when they're present, when they're admitted and discharged and transferred. So when they're entered into your EMR, these notifications must be sent out. As far as what is contained in this e-notification, at a minimum, it needs to be the patient's name, the treating provider, and the sending institution. So any of this data that can be shared beyond that really needs to consist with federal and state laws and regulations. When we're on this topic, patients do not need to sign a specific consent for this e-notification, but they can opt out through their facility's express privacy preference process. So you want to have a way to exclude these from any e-notifications. Secondly, you want to think about if you do have a psychiatric unit or you're a psychiatric hospital, due to the nature and the laws regarding this treatment, it is typical that a patient is going to sign a consent for these e-notifications to be sent out. So you want to follow the protocols and laws around mental health facilities. And then how is this data sent? It can be sent directly from the hospital through an engine or any kind of electronic system that they have, or through an intermediary system. The baseline for communication is HL7 2.5.1. So next, let's talk about what they are looking for as far as meeting these requirements. And the rule talks about reasonable effort. And what is reasonable effort? So essentially, you need to meet the minimum requirements, which is sending e-notifications to the providers for admission, discharge, and transfer. Must be sent real time, and it includes, at a minimum, the name, treatment provider, and sending institution. And this must be sent electronically without restriction. So you don't want to impose any restrictions, whether it be systematic exclusions of a subset of hospitals. Let's say if you're excluding nursing homes or any post-care, you don't want to do that. And you want to be able to send this without putting any restrictions on the providers to receive this notification. Likewise, facilities also must think about the best way to implement and evaluate what value they can provide to their facilities. So thinking about the process and the systems you have to collect this required data, the information from the patient on who these physicians are. And can you send the e-notification electronically, ensuring that you have the ability to send that immediately. Now, you can be forgiven for some of the messages going out if the physician decides to opt out. So think about are you giving your physicians a way to set their preferences and correspond with your facility? Likewise, in addition, if you think about physicians that are receiving this minimum requirement, what is their method to then get additional information? Are you providing a way for your physicians to obtain that, without putting too much burden on your facility? So at this point, it's not a requirement to provide that for the providers, but you do want to think about that and what's going to give the best coordination of care for your patients. Next, we'll talk about compliance. So in the process to receive that, so it is conducted by a state agency or accreditation organization. And what they're going to do is they're going to come in and look at your closed medical records, 10% of your average daily census, and no less than 30 records. So if you are a small facility, you want to make sure that you're hitting that 30 record threshold. If for any reason you cannot meet that requirement, the remediation would be that you would submit a corrective action plan within 10 calendar days and schedule a revisit. Unfortunately, this is not an incentive or a fee for not meeting these measurements. If you cannot meet the remeasurements, it will be a failure to comply, and the facility will be terminated within 90 calendar days of the survey with CMS. So next, as a company, Summit has always focused on integration and automation. And we want to be able to provide the industry methods to meet this requirement, and we have been for some time. So at this time, I'll turn it over to Matt Baker for a review of the Summit All Access platform that can really provide some flexibility and customization solutions to enhance that communication between your facility and the area providers.
Thanks, Meredith. I'm just going to give a brief overview of our solution, Summit All Access for Provider Alert, starting with the basic workflow. In this solution, we receive an ADT message from the HIS for either an admission, transfer, or discharge event. This message then gets processed through our Provider Alert rules engine to determine if a notification needs to be sent. If the system determines that a notification should be sent, we retrieve the custom text for this notification and include information from the event message where appropriate. We then determine who should receive this notification and how those recipients have chosen to receive it. Once that's been determined, we send the notifications in real time in the manner that's been requested. It's important to note that each provider can choose their own method of notification. This can be by email, direct messaging, secure text, or other electronic delivery method. Depending on the delivery method, secure versus insecure, the content of the message can change in order to maintain HIPAA compliance. In addition to selecting how they'll be notified, providers can also select which notifications they'll receive. It's here that they're able to opt out of the required notifications, but also opt into other event notifications that can be defined in the system. In addition to the admit, transfer, and discharge notifications outlined in the CMS ruling, Provider Alert can also provide notifications on other event types, such as the presence of new lab results or critical lab results, or new progress, discharge, or nursing notes, just to name a few. Another key piece is being able to report on the notifications so that the attestation guidelines can be met. Since Provider Alert is fully audited, we can see which events triggered notifications and to whom. The system can then provide the percentages of events that trigger notifications each day for attestation, as well as identifying which providers are receiving notifications and which are not. So follow-up can be done with providers who are not yet signed up to receive notifications or who have opted out of being notified. Once the provider has been notified, then what? With the Summit All Access platform, the provider could be given full real-time access to the clinical data generated by that visit. A link to All Access can also be included in the notification, giving the provider direct access to their patient's data. Here, they're able to see all of the data that's been made available by the hospital, allowing for a better understanding of the patient's condition and care while at the facility, and better continuity of care once the patient's been discharged. Also, since that provider is a provider of record for the patient, they can also view past visit data to get a full picture of the patient's health. With the All Access platform, the system is fully audited, so the hospital staff is able to review who accessed what data and when, and are able to shut down that user's account if data is improperly accessed, keeping them in full control of their data. Now I'll turn it back to Meredith for a look at a couple of our clients already using our solution.
Thank you, Matt. So to give more insight into a couple of facilities that have accomplished e-notification and communication with their area providers, I'd like to give a brief overview of how two facilities have accomplished this in different ways with the Summit All Access software. The first one is a community acute care hospital, which is a level 2 trauma center on the West Coast. They are a 238-bed facility, and their original issue was they were consistently receiving over 150 phone calls a day, requests for faxing from their HIM. They were looking at granting access to their EMR for non-hospital staff, which was a little bit risky and something cumbersome. So in working with us, we were able to establish their All Access back in May of 2016, and we were able to get them up pretty quickly within 3 weeks. So they then in turn received customer satisfaction as the physicians were able to get to the data 24/7. They were receiving their notifications, and they were also being able to track and be able to securely audit their system. So currently, they have over 1 million documents that have been processed and over 315 users. And their data that is being through their system that is being utilized ranges from outpatient, pre-admits, inpatients, as well as ED patients. The second facility is a community acute hospital on the East Coast, and they're a 169-bed facility. And their focus was more on their physician groups and nursing homes within their community. They had a solution in place, but they found that it was very costly and it did lack the regulatory requirements, and they had some security concerns. But they really wanted a way to share the data with their community physicians and their post-acute care facilities. So they're actually going live. They went live in June of 2020. They're doing it in a couple of phases. So phase 1 was June of 2020. And their second phase, they're going to be including statewide physician groups as well as their local community health centers. Since they've actually gone live just about a month ago, they have over 770 users in their system and have already processed 43,000 documents in their system. They also were able to really improve satisfaction, and they had the satisfaction of ensuring their patients receiving the proper follow-up care, as well as knowing that they're meeting the regulatory requirements by providing that secure system. So these are just two examples of how facilities are accomplishing e-notification. and providing supportive methods to their physicians and providing that focus on care coordination in their community. So at this time, I want to bring Christine back to review some of the questions that we have from our clients.
Great. Thanks, Meredith and Matt. Before we conclude today's broadcast, I did just want to take some time to address some of the more frequently asked questions we've been hearing in our conversations with some different hospitals. So I'm going to ask you, Meredith and Matt, to help me answer these. This first question that we've been getting a lot, for the hospitals that already have an integration engine in place, can they accomplish this through that?
I'll take this one. The short answer is yes. Sites would have to set up an ADT to an HIE with notification capabilities, or with the current regulatory requirements, you could send directly to the practitioners if their EMR provided alerts. As a last resort, you could use an integration engine like Summit Exchange that could be configured to send out email alerts upon message receipt.
Great, thanks, Matt. This next question, given that there's a May 1st deadline, what's the implementation timeline, and when would a hospital have to think about implementing this in order to meet that deadline?
Yes, Christine, I can take this one. So implementations may vary on the type of configuration for your facility. If you're looking to use the Summit All Access to accomplish this, we typically have a 3-month window for delivery, which includes install, testing, validation, and go live. But you'll want to start thinking about this now if you have not already, as the deadline will be approaching quickly.
Great, thanks, Meredith. This next question we also have been getting a lot. Does an ITI integration with the HIE satisfy this requirement?
I can also take this one. And it depends on your HIE and if you have a real-time ADT going to your HIE that is capable of sending out notifications. So in particular, as you mentioned, ITI, which is a query response interface, this would not satisfy the immediate notification to the provider, as the provider would have to initiate the inquiry. So there are HIEs out there that are providing notifications to physicians. So you want to have that discussion with them and ensure that they have the capabilities of meeting this measure. The key components is looking at working to ensure that the notifications are being sent out to the providers immediately upon admission, transfer, and discharge with the minimal amount of data that is required.
Perfect, thanks, Meredith. And then lastly, can hospitals just give their providers direct access to Meditech or their EMR to meet the requirement?
Certainly they can. As we've seen with many of our clients and different facilities that we have talked to, it is an option. You do have to manage those logins and having the physicians, but there could be just some hurdles and burdens that you have to be aware of if you want to give direct access to your system. Now, this does not satisfy them getting the notification out. It would then just satisfy them being able to see the diagnosis and more information on the patient.
Okay, great. Thanks, Meredith. So just a reminder to everyone on the line, we will follow up on any questions that came in throughout the presentation. And of course, if you have any questions at a later time, you can always reach out to us at info@summit-healthcare.com or visit us at our website. With that said, that will conclude today's webcast. And again, we will be sending all attendees a copy of today's presentation, as well as a link to view the recorded session. Thanks, everyone, and enjoy the rest of your day.